All right. Let's dive into heart attacks.
Oh, yeah?
Everyone wants to understand this better, right?
Definitely.
We got some excerpts about this.
Okay.
And I have to say, the stuff in here, really eye-opening. We're going deep.
Okay.
It's not just skimming the surface.
Right.
What causes a heart attack?
Mm-hmm.
How do we even recognize the signs? They can be sneaky.
Yeah, yeah.
And most importantly, what can we actually do
Right.
to, lower our risk?
Absolutely. Because with heart health,
Yeah,
knowledge is power.
totally. And trust me, there are some things in here
Huh?
that even your, resident info junkie, I was
Okay.
like, whoa, I didn't know that.
Oh, really?
Like, did you know that you can actually have a heart attack
Mm-hmm.
even if an artery isn't completely blocked?
Wow.
Or that some people have almost no symptoms at all?
It's wild.
It's wild. Okay,
It is.
so back to basics.
Okay.
Can you walk us through what actually happens
Sure.
during a heart attack? Yeah.
What's going on in the body?
So imagine your coronary arteries,
Mm-hmm.
the ones supplying blood to your heart muscle, right?
Okay.
Like pipes.
Pipes. Got it.
Over time, plaque builds up inside them.
Okay.
Now, instead of just thinking of plaque as like gunk,
Yeah.
picture hardened grease
Good.
clinging to those pipes,
Okay.
slowly restricting the flow.
That's vivid. I like that.
Yeah,
So slow motion plumbing problem.
exactly.
Okay.
And just like a pipe can burst,
Oh, no.
this plaque can rupture.
Right.
And when that happens, a blood clot forms
Oh.
right at the rupture site.
Okay.
And that clot
Yeah.
is what can completely block blood flow,
Wow.
starving the heart muscle of oxygen.
So that lack of blood flow,
Yeah,
that's what causes the damage.
tragically, yes.
Wow.
And potentially destroys part of the heart muscle.
So the faster you get help,
Yes,
the less damage.
absolutely.
Okay.
Time is muscle.
Got it.
Every minute counts.
Don't wait.
Do not wait. Don't tough it out.
Right.
Call for help immediately.
Right away.
If you even suspect
Yeah.
you might be having a heart attack.
Exactly.
Speaking of suspecting a heart attack, let's talk symptoms.
Okay.
We've all seen the movies, right?
Uh-huh.
Someone clutches their chest.
Yeah.
Collapses dramatically.
Right.
Is it always that obvious in real life?
Not at all.
Real?
Heart attack symptoms
Yeah.
can range from mild to severe.
Wow.
And vary hugely from person to person.
Yeah.
While the classic symptom is chest pain,
Right.
often described as pressure, tightness, squeezing,
Mm-hmm.
or even aching.
Yeah.
It doesn't always play out
Okay.
in such a stereotypical way.
So then what should we be looking out for?
Yeah.
What are the red flags that shouldn't be ignored?
Besides chest pain,
Okay.
you might feel discomfort spreading
Okay.
to your shoulder, arm, back, neck, jaw, teeth, even your upper belly.
Wow. Okay.
You could experience cold sweats, fatigue, heartburn, lightheadedness, nausea.
Yeah. Or shortness of breath.
Okay, that's a much longer list than I expected.
Yeah.
And you mentioned earlier
Yes.
that women often experience heart attacks differently.
Right.
What makes their symptoms unique?
It's partly because
Yeah.
women are more likely to develop blockages in smaller arteries,
Okay.
leading to less obvious signs.
I see.
Plus, societal expectations sometimes lead women
Yeah.
to downplay their symptoms or
Right.
attribute them to something else.
Makes sense.
So while those classic symptoms are important to know,
Yeah.
women especially
Right.
need to be aware of these subtler variations.
That's a good point.
Yeah.
So basically,
Mm-hmm.
any unusual discomfort
Yes.
in the chest
Yes.
or upper body,
Yeah.
especially with exertion or stress,
Right.
should be taken seriously.
You got it.
Okay.
You know your body best.
Yeah.
If something feels off,
Right.
don't hesitate
Oh, wait.
to seek medical attention.
Right.
And one more thing to keep in mind. Okay, angina.
Angina.
Yeah.
Isn't that just chest pain?
It is chest pain or pressure,
Right.
but specifically the kind that comes and goes,
Okay.
especially during activity.
Ah.
It's caused by
Yeah.
a temporary decrease in blood flow to the heart, and it
Yeah.
can be a warning sign
Oh.
that something's not quite right.
Okay. That's definitely something to pay attention to.
Yeah.
So
Yeah.
let's say the worst happens
Okay.
and you or someone you're with
Huh.
starts experiencing these symptoms.
Right.
You think it might be a heart attack.
Mm-hmm.
What's the absolute first thing you should do?
Without a doubt.
Okay.
Call 911 immediately.
Okay.
I can't stress this enough.
Got it.
Every second counts.
Don't wait.
Do not wait.
Don't try to downplay it. Don't try to drive yourself to the hospital unless it's literally impossible to call for help.
Exactly.
Okay. Get help on the way ASAP.
As soon as possible.
What else is important to do?
Yeah. in those first crucial moments.
If you've been prescribed nitroglycerin,
Okay.
take it as directed while you wait for the ambulance.
Got it. Right.
And if your doctor has specifically recommended it,
Yep.
consider taking aspirin.
Aspirin. Oh.
Okay? It can help prevent clotting
Mm-hmm.
and potentially minimize damage to your heart.
Yeah. So aspirin isn't a bad idea.
Right.
But always best to check with your doctor first.
Exactly.
Right.
Yes.
Especially since every minute counts.
Exactly. Now, what if you see someone else
Okay.
who you think might be having a heart attack?
Okay.
What should you do?
I'm guessing.
Yeah.
Same rule applies.
Uh-huh.
Call 911 immediately.
You're absolutely right.
Okay.
Then check to see if they're conscious and breathing.
All right.
If they're unconscious and not breathing,
Mm-hmm.
or you can't find a pulse,
Yeah.
start CPR.
Take PR. Got it.
Even if you haven't had formal CPR training,
Okay.
don't panic.
Right.
Focus on hands-only CPR.
Okay.
Push hard and fast in the center of their chest.
Got it.
Aiming for about 100 to 120 compressions per minute.
So just keep that blood flowing as best you can.
Exactly. Now, if you are trained in CPR,
Yeah.
you can do the classic cycle
Right.
of 30 chest compressions, followed by 2 rescue breaths.
Mm-hmm.
But honestly, for most people,
Yeah.
learning hands-only CPR
Yay.
is a huge step
Right.
towards potentially saving a life.
That's a great point.
Yeah.
Okay, we've covered what happens during a heart attack
Right.
and the immediate steps to take.
Yes.
But what causes these things in the first place?
Yeah.
Is it all about genetics?
It's a bit of both, actually.
Okay.
While things like age and family history are out of our control,
Yeah.
the good news is
Okay.
that many other risk factors are modifiable.
Okay, that's good. So our lifestyle choices
Yes.
play a huge role in shaping our heart health.
Absolutely.
So let's talk about these risk factors.
Okay.
What are the big ones
Yeah.
everyone needs to be aware of?
The major culprits are age.
Okay.
Men over 45 and women over 55 are at higher risk.
Right.
Then there's tobacco use,
Right.
including smoking,
Of course.
and long-term exposure to secondhand smoke.
Right, right.
High blood pressure, high cholesterol or triglycerides, obesity,
Yeah.
and diabetes also significantly increase your risk.
That sounds like the usual suspects we hear about all the time.
Right.
Are there any lesser-known risk factors that might surprise people? I know the source material mentioned a few.
There are indeed.
Okay, like what?
For instance, stress,
Oh, stress, yeah.
both chronic and acute,
Right.
can take a serious toll on your heart.
Okay.
Another big one is lack of physical activity.
Lack of exercise, right?
Yes.
Got it.
And you might be surprised to hear
What's that?
that even certain infections,
Infections, like
Yeah.
a cold or the flu.
not just those,
Oh, okay.
think COVID-19,
Yeah,
which we know can damage the heart muscle,
right.
but also things like Lyme disease.
Wow.
And even some viral infections can trigger inflammation of the heart muscle.
Wow, I had no idea infections could play a role.
Yeah.
So it really is this complex web of factors, right? Some we can control, some we can't.
Right.
But it sounds like the takeaway is
Yeah.
making healthy choices can really move the needle.
Absolutely. Even small changes can have a big impact over time.
Right.
It's never too late to start prioritizing your heart health.
So let's get into what those healthy choices actually look like.
Okay.
What are the most effective ways to prevent a heart attack?
Well, it all starts with those lifestyle modifications we talked about.
Okay, like what?
Quitting smoking,
Right.
maintaining a healthy weight,
Mm-hmm.
adopting a heart-healthy diet,
Okay.
and getting regular exercise are all essential.
Right.
And don't underestimate the power of managing stress
Mm-hmm.
through techniques like mindfulness
Okay.
or yoga.
And I'm guessing managing existing conditions like high blood pressure or diabetes is key too.
Absolutely. Following your doctor's advice,
Yeah.
taking your medications as prescribed,
Well,
and attending regular checkups can make a world of difference.
okay, that's a lot to take in.
It is.
But before we get too overwhelmed,
Yeah.
let's shift gears a bit
Thanks,
and talk
yep.
about something I found fascinating in the source material,
All right.
different types of heart attacks.
Okay.
It mentions STEMI and STEMI.
Mm-hmm.
Can you break those down for us?
Of course.
Okay.
Doctors use these terms based on readings
Mm-hmm.
from an electrocardiogram or ECG.
Okay.
Think of a STEMI
Okay.
as a major highway being completely blocked,
Oh, wow.
while an NSTEMI
Okay.
might
yeah.
be more like a side road closure.
So both are serious,
Both serious.
but requiring different responses.
Yeah.
So both are heart attacks,
Yes.
but a STEMI is generally more serious.
Yes.
Okay.
A STEMI which stands for ST elevation myocardial infarction, typically indicates a complete blockage of a major coronary artery. It usually involves more damage.
Right.
And requires more aggressive treatment.
And an NSTEMI,
Yes.
or non-ST elevation myocardial infarction, usually means a partial blockage or a blockage in a smaller artery.
That's right.
Okay.
Both require prompt medical attention.
Right.
But the specific treatment approach will depend on the severity of the blockage and the overall condition of the patient.
This is starting to make a lot more sense.
Good.
Now, before we move on, there's one more thing I wanted to touch on that really surprised me in the source material.
Oh, yeah?
Coronary artery spasms.
Okay.
How are these different from the plaque-related blockages that we've been talking about?
That's a great question.
Yeah.
Think of it like a muscle cramp.
Oh, okay.
But instead of in your leg,
Right.
it's happening in the artery itself.
In the artery, okay.
This sudden, severe tightening of the coronary artery can also block blood flow and lead to a heart attack.
So even if your arteries are relatively clear, you could still have a coronary artery spasm and potentially a heart attack.
That's right.
Wow.
It's another reminder that heart health is complex.
Okay.
And various factors can contribute to a heart attack.
So these spasms aren't always caused by plaque buildup.
Well, not always.
Okay.
Though people with existing heart disease or risk factors like smoking are more susceptible.
Wow. That really highlights that even if you're doing everything right, there can be unexpected factors.
Yes.
But that doesn't mean we're powerless.
No, not at all.
Let's shift gears now and talk about what we can control through lifestyle.
We were talking about lifestyle and how it impacts our risk of heart attacks.
Right.
And I know you're particularly interested in the link between stress and heart health.
I am. It's one of those things we all know is bad for us, but I'd love to understand, like, the mechanics of it. How does stress actually mess with our hearts?
It all comes down to hormones.
Hormones, okay.
When you're stressed, your body pumps out adrenaline and cortisol.
Right.
These hormones cause your heart rate to spike and your blood vessels constrict.
So it's like...
which temporarily raises your blood pressure.
Our body going into fight or flight mode. Right?
Exactly.
Okay.
And if it's a one-off stressful event, it's not a big deal.
Right.
Your body is designed to handle these short bursts. But it's when stress becomes a constant companion that the trouble really starts.
So chronic stress is the real heartbreaker.
Unfortunately, yes.
So to speak.
Over time, chronic stress fuels inflammation in your arteries, making them more vulnerable to plaque buildup.
Right.
It can also lead to unhealthy coping mechanisms.
Oh, like what?
Like reaching for that extra slice of cake.
Oh, yeah.
Lighting up a cigarette or pouring another glass of wine.
All the good stuff.
All of which further increase your risk.
So it's not just the stress itself,
right,
but the domino effect it can have on our choices.
Exactly.
That's a good reminder to find healthy ways to de-stress.
Yes.
Like exercise, meditation, or spending time outdoors.
Couldn't agree more. And speaking of exercise, a lack of physical activity is another often overlooked risk factor.
Right.
When you're sedentary, your heart muscle weakens.
Okay.
Your blood flow becomes less efficient.
Right.
And you're more likely to gain weight.
Yeah.
And develop conditions like high blood pressure and diabetes.
Oh, wow.
All of which set the stage for a potential heart attack.
So getting regular exercise is like a 2-for-1 deal.
It is.
It strengthens your heart and helps prevent other risk factors.
Exactly.
Now, something else in these sources really surprised me.
Okay.
The connection between infections and heart health. So I've talked about COVID-19.
Right.
But are there other infections
Yes.
that can impact our hearts?
There are indeed.
Okay.
Several infections have the potential to damage the heart muscle.
Like what?
For example, viral infections like the flu,
Okay.
Coxsackie virus, even the common cold.
Even a cold.
Can trigger myocarditis.
Myocarditis.
It was inflammation of the heart muscle.
Okay.
And bacterial infections, like Lyme disease and endocarditis, can damage heart valves.
Okay.
Raising the risk of future heart problems.
That's unsettling.
It is.
I never realized infections could play such a direct role in heart health.
Yeah, it's all interconnected.
It really emphasizes the idea that our overall health is interconnected.
Absolutely.
Taking care of one part of our body impacts all the others.
You've hit the nail on the head.
Okay.
Taking steps to boost your overall health.
Like what?
Like getting vaccinated.
Okay.
Practicing good hygiene. And prioritizing a healthy lifestyle can go a long way in protecting your heart.
Okay, so we've done a deep dive on risk factors.
Yes.
Now let's talk about prevention.
Okay.
We've touched on lifestyle changes.
Right.
But what else can people do to proactively reduce their risk?
Besides the foundation of a healthy diet, regular exercise, and stress management, there are a few other key areas to focus on.
Like what?
First, managing any existing health conditions is crucial.
Okay.
If you have high blood pressure, diabetes, or high cholesterol,
Right.
working closely with your doctor
Yeah.
to control these conditions is paramount.
So it's not just about preventing these conditions,
Right.
but also being diligent about managing them if you've already been diagnosed.
Absolutely.
Got it.
Following your doctor's advice
Okay.
and taking your medications as prescribed
Right.
is non-negotiable.
Don't skip doses or stop taking your meds
Right.
without talking to your doctor first.
Exactly.
Yes.
Consistency is key.
That's a great reminder.
Yeah.
Now, I know regular checkups are essential for overall health, but are there specific tests
Yes.
that can help assess heart health and catch problems early on?
Yes, there are.
Like what?
Your doctor might recommend an electrocardiogram
Okay.
or ECG,
Right.
which measures your heart's electrical activity and can detect any irregular rhythms.
Okay.
Another common test
Yeah.
is an echocardiogram.
What does that do?
It uses sound waves
Okay.
to create images of your heart,
Huh.
allowing doctors to spot structural issues
Okay.
like valve problems or heart muscle damage.
So these tests provide a window
They do.
into how our heart is functioning,
Exactly.
potentially catching problems
Yeah.
before they become serious.
Precisely.
Okay.
And that's the key with heart health.
What is it?
Early detection.
Got it.
The sooner an issue is identified,
Right.
the sooner treatment can begin.
Okay.
And that can make all the difference in preventing serious complications down the road.
Right. Right.
Now, while we're on the topic
Yeah.
of potentially serious issues,
Okay.
I want to mention something
Okay.
that was covered in the material you sent.
What's that?
Spontaneous coronary artery dissection,
Okay.
or SCAD.
SCAD. I have to admit, that one's new to me.
Yeah, it's rare.
Okay.
What exactly is it? It's a rare but serious condition
Okay.
where a tear develops
Oh.
in one of the coronary arteries,
Okay.
the very vessels responsible for delivering oxygen-rich blood to your heart muscle.
Right.
This tear can block blood flow,
Oh.
leading to a heart attack.
That sounds terrifying.
It can be.
Is it like the plaque ruptures we talked about earlier?
Not exactly.
Okay.
What makes SCAD particularly scary
Like that.
is that it often affects younger women
Oh, wow.
who are otherwise healthy
Okay.
and don't have the typical risk factors for heart disease.
Wow, that really highlights that this isn't just an old person problem. What causes SCAD?
Unfortunately,
Yeah.
the exact cause is still a mystery.
Okay.
Researchers believe that factors
Yeah.
like hormonal changes during pregnancy
Okay.
or even intense physical activity
Wow.
might play a role.
So there's no guaranteed way to prevent it.
Not yet.
Okay.
But managing stress,
Right.
avoiding extreme physical exertion,
Okay.
and seeking immediate medical attention.
Yeah.
If you experience any unusual chest pain or discomfort,
Right.
are crucial.
Okay. I'm definitely filing that one away in my mental things to be aware of folder.
Good idea.
We've covered a lot of ground here
We have.
on risk factors and prevention strategies.
Yes.
Before we move on,
Okay.
I want to circle back to something you mentioned earlier.
Yeah?
CPR.
Okay.
Why is learning CPR so crucial?
Yeah.
Especially in a heart attack situation.
That's a fantastic question.
Yeah.
CPR, or cardiopulmonary resuscitation,
Right.
is a life-saving technique
Okay.
that can keep blood and oxygen flowing
Mm-hmm.
to the brain and other vital organs
Right.
when someone's heart stops beating.
I know it's important, but can you remind me why?
Of course. During a heart attack,
Yeah.
there's a risk of the heart going into cardiac arrest,
Right.
which means it suddenly stops pumping blood.
Yeah.
In these critical moments,
Okay.
CPR can literally be the bridge between life and death.
So even if you aren't a medical professional,
Right.
knowing CPR gives you the power to take action
Yes.
and potentially save someone's life.
Absolutely.
That's incredible.
It really is.
Yeah.
And learning CPR is easier than you might think.
Okay.
Many organizations offer training,
Right.
both in person and online.
That's great.
I can't encourage everyone enough
Yeah.
to learn this vital skill.
Okay.
You never know when you might need it.
I love that.
Yeah,
Knowing CPR is like having a superpower.
it is.
And on that empowering note,
Yes.
let's shift our focus to what happens after a heart attack. What does treatment and recovery look like? We've covered a ton of ground already.
We have.
The science behind heart attacks,
Yes.
the risks, the symptoms,
Right.
and even how to take action in an emergency.
It's a lot.
But what happens after a heart attack?
But that's an important question.
What does the road to recovery even look like?
Well, surviving a heart attack is a huge victory.
Right.
But it's just the beginning.
Oh, okay.
The journey to recovery and preventing future events is just as crucial.
Okay.
Thankfully, modern medicine has come a long way
That's good.
in treating heart attacks and helping people live full lives afterwards.
So what happens right away?
Well,
What's the immediate treatment like?
Okay, so the first priority
Yeah.
is to restore blood flow to the heart muscle
Right.
as quickly as possible.
Okay.
We often start with medications to break up blood clots.
Okay, like what?
Aspirin, which we
Right.
talked about earlier,
Right.
is usually given immediately.
Got
Other medications might include clot-busting drugs
Okay.
or antiplatelet agents,
And those,
both of which help prevent further clotting.
I've also heard of angioplasty and stents being used.
Yes,
Do those play a role in heart attack treatment too?
absolutely.
How so?
Angioplasty is a procedure
Okay.
where a tiny balloon is threaded into the blocked artery
Ah.
and inflated to widen the passage.
Oh, okay.
Often, a stent, which is basically a small mesh tube,
Great.
is inserted to keep the artery open.
Keep it open. Okay.
These procedures are usually done during a cardiac catheterization,
What's that?
where a thin tube is inserted
Okay.
through a blood vessel in the groin or arm
Mm-hmm.
and guided to the heart.
It's pretty mind-blowing that we can do that.
It is remarkable.
But what about the damage that's already been done to the heart muscle during the heart attack? Is that something that can be reversed?
Unfortunately, most of the time,
Yeah.
the damage is permanent.
Oh.
However, the goal of treatment is to minimize the extent of the damage
Right.
and prevent further complications.
Okay.
That's where cardiac rehabilitation comes into play.
I've heard that term before,
Yeah.
but I'm a little fuzzy on what it actually involved.
Cardiac rehab is a medically supervised program
Okay.
designed to help people recover from a heart attack
Right.
and get back on their feet,
Yeah.
both physically and emotionally.
So it's not just about the physical recovery,
Right.
but also the mental and emotional aspects
Exactly.
of going through such a serious event.
A heart attack can be incredibly traumatic,
Right.
and cardiac rehab provides a safe and supportive environment
Okay.
for people to learn about their condition, develop healthy habits,
Yeah.
and build back their confidence.
That sounds incredibly valuable.
It is.
You mentioned earlier that medical advancements have really improved outcomes
Yes.
for heart attack survivors. What are some of the most exciting developments happening right now?
Well, we're seeing amazing progress in developing new medications
Oh, okay.
that are even more effective
What?
at preventing blood clots
Sure.
and protecting the heart muscle.
Oh, crap.
We're also making strides in imaging techniques,
Ah,
which allow doctors to visualize and assess the damage
okay.
after a heart attack
Right.
with much greater precision.
So we're getting better at both treating the immediate aftermath
Yes,
and preventing future problems.
exactly.
What about the bigger picture?
Okay.
What does the future hold for heart health?
That's an interesting question.
What kind of breakthroughs are on the horizon?
One area that holds immense promise
Okay.
is personalized medicine,
Personalized medicine.
where treatments are tailored
Okay.
to an individual's unique genetic makeup
Right.
and specific risk factors.
I see.
We're also seeing some really exciting developments
Yeah.
in gene therapy and stem cell research.
Wow.
Imagine a future where we can actually regenerate damaged heart tissue.
That would be incredible.
It would indeed.
Yeah.
And while these technologies are still in the early stages of development,
Right.
they offer tremendous hope for the future of heart health.
This deep dive has been so eye-opening.
It has.
We've really explored everything from the cellular level
Right.
of what happens during a heart attack to the cutting-edge advancements
It's fascinating, isn't it?
that are shaping the future of heart health.
Yes.
Before we wrap up,
Go.
I want to leave our listener with a question to ponder.
Right.
Knowing all that we've learned today,
Yeah.
what's one small change you can make today to benefit your heart health?
Okay.
It could be something as simple as taking a walk,
Right.
choosing a piece of fruit over a cookie,
Yes.
or just taking 5 minutes to breathe deeply and de-stress.
Those are all good ones.
Remember, even small steps can have a big impact over time.
I completely agree.
Right.
And ultimately,
Yeah.
knowledge is power when it comes to heart health.
That's a great point.
By understanding the risks, making choices to prevent heart attacks,
Right.
and seeking immediate medical attention when needed.
Okay.
We can all live longer, healthier, and more fulfilling lives.
That's a perfect note to end on.
It is.
Thanks for joining us on this deep dive into the world of heart attacks.
My pleasure.
Remember, you are in control of your heart health.
Yes, you are.
Make it a priority.
Please do.
And your heart will thank you for years to come.
Absolutely.
Until next time.